Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we're going to discuss a very common presenting complaint in the outpatient departments when we are working as a clinical physician or when we are working in the outpatient departments in the ocular or the ophthalmology department. So we usually come across this red eye, and one should know how to differentiate or distinguish between the different causative factors that are going to present as a red eye in a patient. The differential diagnosis of a red eye includes the different causative factors. It can range from the causative factors of trauma in the patient, and on one hand we have the infectious and the inflammatory causes which can manifest in a disease as the ocular manifestation of a red eye in a patient. Even the systemic diseases are sometimes associated with a red eye, such as inflammatory bowel disease, we have hypertension, we have Georgian syndrome. A lot of drugs, for example, even for instance, aspirin is sometimes associated with the presenting complaint of a red eye in a patient. So over here in this lecture, in the very first section, we're going to focus on conjunctivitis, which is one of the leading cause of the red eye presentation in a patient. Then we're going to move on to hemorrhages. Hemorrhages are quite serious or quite fatal in a person, but sometimes over here when we are just dealing with a eye hemorrhage which is associated with any hypertensive disorder, or some of the hemorrhages are associated with stroke, they can be self-limiting. Making the patient well aware of this condition is very important over here. Giving him the core knowledge is again very important over here. So the dry eye syndrome or keratoconjunctivitis is some of the presentations, some of the causative factors which can again correlate to a red eye in a person. In the second section, we are going to just discuss the other miscellaneous infections that basically relate to episcleritis. Then we have scleritis. On one hand, we should know how to distinguish episcleritis from scleritis because these are some of the interior structures that are located in the eye, and their infections can manifest as redness of the eye in the patient. Then on the other hand, we have the other inflammatory changes such as uveitis. All of these differential diagnoses have to be kept in mind, and we have to make a conclusive diagnosis in a patient because the treatment modalities would finally be associated with this final diagnosis or with this final conclusive diagnosis in a patient. In the third and the final section, we'll be dealing with the red eye examination. So one should be well versed how to basically examine a red eye in detail, how to get a complete history from the patient. And then we'll be dealing or discussing the angle closure glaucoma, which can again be quite vision threatening to the person. So the accurate diagnosis at the earliest stage possible is very important over here. Then we'll be briefly or comprehensively discussing blepharitis again, and blepharitis is the lid infection, but still it can manifest or it can include the meibomian glands, which in turn can basically manifest as a red eye in the patient. So I hope you want to learn more about these red eye diseases, so do watch the other sections to this lecture as well.